What is cervical dysplasia and HPV DNA testing? Imagine a tiny change happening on the surface of your cervix that could someday lead to a serious health issue. That's what cervical dysplasia is. It's a condition where abnormal, precancerous cells develop on the cervix, which is the lower part of the uterus connecting to the vagina. These cell changes are not cancer yet, but if they are left untreated, they can sometimes progress into cervical cancer over time. Most cases of cervical dysplasia are caused by infection with certain types of human papillomavirus, or HPV, which is a very common sexually transmitted virus. The types most strongly linked to cervical dysplasia and cervical cancer are HPV 16 and HPV 18. Interestingly, many women with cervical dysplasia don't notice any symptoms. That's why routine screening tests like the Pap smear are so important. They can detect these abnormal cells early on, often before any symptoms appear. Now, to understand how we identify high-risk HPV infections, we look at HPV DNA testing. This is a laboratory test that searches for the genetic material, or DNA, of high-risk HPV types in cervical cells. It's often used alongside the Pap smear or after an abnormal Pap result to better understand a woman's risk level. Since HPV infection is the main cause of cervical dysplasia, detecting the virus early can help doctors decide whether a woman needs closer monitoring or treatment. HPV DNA testing is especially useful for women aged 30 and older because persistent infection with high-risk HPV types increases the chance of developing more serious cell changes. This test can find infections even before abnormal cells appear, giving an opportunity for early intervention. In terms of classification, cervical dysplasia involves abnormal cell changes in the cervix, which are graded as mild, moderate, or severe. These are also called cervical intraepithelial neoplasia grades 1 through 3. Mild dysplasia, or SIN1, often resolves on its own without treatment. But moderate to severe dysplasia, or SIN2 and SIN3, are more likely to need medical intervention to prevent progression to cervical cancer. Most cases are caused by persistent infection with high-risk HPV types, and symptoms are rare but may include abnormal bleeding or discharge if the condition advances. Diagnosis usually starts with a Pap smear, and if abnormal, a biopsy can confirm the presence and severity of dysplasia. HPV DNA testing plays a key role in this process. It detects the presence of high-risk HPV types associated with cervical dysplasia and cancer. The test can be used to follow up on abnormal Pap results or as a primary screening tool for women who want extra reassurance. By identifying women with high-risk HPV infections, healthcare providers can recommend closer surveillance or treatment options. This testing complements Pap smears, making it easier to catch potential problems early. From the perspective of reproductive health, cervical dysplasia is a critical early step in the development of cervical cancer, which remains one of the major reproductive cancers affecting women worldwide. Using HPV DNA testing to detect the viral cause of dysplasia allows for timely intervention, which can prevent the progression to invasive cancer. Medical guidelines emphasize the importance of regular screening and HPV testing as effective strategies for prevention. In summary, cervical dysplasia is a precancerous condition caused mainly by high-risk HPV infections. HPV DNA testing is a powerful tool that helps detect these infections early, enabling healthcare providers to monitor and manage the condition before it develops into cancer. This approach aligns with current medical standards aimed at reducing the burden of cervical cancer through early detection and prevention. Remember, if you have concerns or questions about cervical health, always consult a healthcare professional for personalized advice and screening options.